Hello, my name is Victoria Itoyan. I'm a student nurse practitioner. How are you?
I'm okay.
What brings you here today?
It's my son Jack. For the last couple of days, he's been having a fever. The high's been 104. I give him Tylenol, but it doesn't. It just goes away for a while, and then it comes back. So I'm just worried.
So exactly how many days it is?
Two.
Two. Okay. Is he eating?
You know, today he didn't touch anything. He didn't want anything to drink, eat. He gets fussy, doesn't want to sleep, or take his naps.
How about wet diapers today?
None.
How about yesterday?
He did. He had a normal
wet
amount.
Okay. Runny nose?
Yeah, just
A little.
continuously. Yeah.
Okay. How about his ear? Is he itching, rubbing?
He is
aching?
rubbing and touching it a lot on the right side, and I don't know, like he has a little discharge.
Discharge in the
Yeah.
right eye?
Yeah.
Okay. Is he vomiting or diarrhea or anything?
Nothing like
Neck stiffness?
that. No. Not
Tummy
at all.
ache?
He doesn't. No.
He doesn't. It doesn't hold.
touch
he
it.
doesn't touch it.
No.
Okay. Any other problems he has?
No. You know, actually a month ago he did have an ear infection. I don't know if it's the same with what's going on now, but like you gave him antibiotics and he was fine, but I
Yeah.
gave him amoxicillin.
Okay, yeah, we'll give him an amoxicillin. So he's having it again now, it seems, huh? And then no other history, no other problems?
No.
Okay. Does he go to daycare?
He does 3 times a week because of my job, so
Okay. And do you feed him with a bottle? Or?
you know, honestly, I do still feed with a bottle one bottle a day.
Okay.
Yeah.
All right. So it's better to use a sippy cup right now because he's 2 already, and that would decrease air problems also. Any medical problems you and your husband have?
I don't have anything, but thinking as a kid, I did have ear infections as well, and I had to have those tubes placed in.
Okay. All right.
Yeah. The only other thing with my husband is I'm trying to get him to quit, but he still smokes. So yeah, I know.
You know, smoking also aggravates ear problems, ear infections. So it would be better, yes,
All
if
right.
he quits.
Yeah.
So any allergies he has?
No allergies.
He lives with you in a house?
Mhm.
With you and your husband?
Yes.
Huh? Any other siblings?
No.
Okay. Any other places hurt? Any other problems you want to mention?
No, just no.
Okay. So I can see his growth chart. We took his temperature, blood pressure, and everything. They're all okay. His temperature is 99, which shows that you also give the Tylenol. Now it's dropping a little, and he is proportional on the. His weight and height are proportional. How about his? Let's check his developmental status. He says 2-word sentences.
Yes, it does.
Okay, and then he runs and he jumps around.
Yeah, he's very energetic.
Okay, good. Alrighty, so let's examine him. I want you to hold him so that he doesn't become so fuzzy and all that. Okay, I'm gonna check his lymph nodes. Good. They're fine. I'm gonna check his ears. Alright, there it is. It's red, so there's also fluid. So a right ear is a problem. It was the same ear last time, right?
Yeah.
Yeah, I remember. Left is totally fine. Alright, and then I'm gonna check his eyes. Okay, your red reflex is normal. And this little discharge looks viral to me, so it's not too bad. Gonna check his nose. There's no redness, just a little irritation, that's fine. no greenish discharge, it's just clear, so that's okay. He's, can you put your mouth? Okay, there you go. With the tongue depressed, I'm looking. Yeah, not too bad. Nothing in there, no redness even. And then his mucous membrane is okay, so there's no dryness, not much. Okay, now I'm gonna listen to his lungs, but I want you to hold him on your shoulders so that he doesn't cry. His lungs are normal, it's clear. Let me listen his heart. It's okay. I'm gonna listen also his tummy. His bowel sounds are there, so they're fine. Just gonna have a bowel movement pretty soon. Okay, so can we put him in here? Mom, I want you to hold his leg. We're gonna do a test and see if he has the neck rigidity. Let me see. Okay, no neck stiffness, so that's fine. I'm gonna do his reflexes, his molar reflex. And he's gonna check his back. It's the curvature is fine. It's normal. Okay, and I'm gonna check his genitalia. We're gonna undress him right now. Okay. Oh, okay. His testes are normal and scrotum is fine. So you can dress him right now. Okay. Sorry, Jack.
I know it's very fussy right now.
Okay. Alrighty. So let's talk about what I found from my assessment. Overall, the main problem is the ear infection that he's having it, and it's the second time that he's having it. So first we gave him amoxicillin, so now we're gonna go something stronger, and it's gonna be augmentin. You're gonna give 1 teaspoon twice a day, 1 in the morning and 1 at night. And try to give it when there's something in his stomach, because I know he can't have, I know he's not able to hold any food in, because he's not eating too much, but try to give him small bites, the things that he likes. And then for fever, you're giving him already Tylenol every 6 to 8 hours, 1 teaspoon. So continue with that, and you can alternate with Motrin as well if the fever doesn't go down that quickly. You can give Motrin 1 teaspoon every for 6 to 8 hours, and also I'm going to give a drop for the ears, which will calm down the itching and that. It's called abiotic drops. So you're going to put 2 drops every 4 to 6 hours on the right ear. And try to give him fluid as much as you can, and like water or milk or any kind of fluids so that he can get some hydration. He's not too dry because his skin was fine, and when I checked his mouth, his mouth is not that dry, so it doesn't show that he's too dehydrated, which I had to admit to the hospital if that happened, but now he's doing okay. So we're going to give him some, increase his fluid at home, and take the antibiotics. I want you to come and see me in 2 days, but if you have any aggravation of symptoms, like if the temperature is not going down, or he gets more fuzzy, he's not eating or drinking, call me right away, and then we can take measures at that appropriate time. And his vaccination status is all currently checked in the chart, and he doesn't have any vaccines for now. And that's about it from my end. You're gonna work on your husband so that he can stop smoking, right?
Yeah, definitely.
Okay. And you're feeding him appropriately because his height and weight are very, very proportional.
Hey.
So whatever you're doing, continue. And do you give him veggies and fruits and everything?
Yes, of course.
He's
likes
getting
it.
a balanced diet, huh? Good job, Mom. Alrighty, any questions for me?
Thank you so much for
Okay.
everything.
Alrighty, see you next time.
See you.
Bye-bye.
Bye.